Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vic Sinise. We meet every Saturday at 10:30 a.m. Central Time. And if you're watching us live, we're on YouTube and Facebook Live every week. And you can always watch our on demand by going to our UroPatient.com website, where you'll find all of our past episodes. Also, the best place to go to get any of our handouts. We've got a bunch of them, so go and check those out. Every program I put out, I have a handout with valuable information for you guys. So let's get started with our show this week. So this week, we're going to be talking about kidney stones, stents and danglers, understanding the basics. I'm excited to discuss this important and often misunderstood topic, kidney stones, stents, and danglers. We'll go over what kidney stones are, how stents manage them, and what danglers are, and how they contribute to patient care. So, hey, if you're ready, I'm ready. Let's get started. So first, what exactly are kidney stones? Well, kidney stones are hard deposits of minerals and salts that form inside your kidneys. They develop when substances like calcium, oxalate, and uric acid are in higher concentrations than our urine can dilute. Common risk factors include not drinking enough water, certain diets, and even genetics. We also see different types of stones, such as calcium oxalate, uric acid, struvite, and cysteine stones, each with different characteristics and treatment considerations. Sometimes we really underestimate how important water is in keeping kidney stones. I had one urologist once tell me that if you drank enough water that your urine was clear, you probably wouldn't make a stone. Kidney stones are notorious for causing severe pain. Patients often feel this pain in the side or lower back as a stone moves through their urinary tract. When we're talking about severe pain, this one is known as the worst known pain to mankind, worse than labor pains. Additionally, symptoms can include blood in the urine, nausea and vomiting, as well as persistent urge to urinate. This pain, as I said, can be quite intense and is one of the primary reasons people seek medical attention for stones. Always one of these things that it's probably a trip to the emergency room. We've had patients call up and think they might have a stone, and there's just nothing we can do in the office to treat for that. You need a heavy duty narcotics, which we don't carry in our offices. So how do we diagnose kidney stones? Well, to diagnose them, we rely on imaging techniques. And our number one favorite is the CT scan. It's fast and provides clear images of stones in the urinary tract. Now, ultrasounds are also helpful, especially when trying to avoid radiation. Blood and urine tests can further help us understand what type of stone we're dealing with and guide treatment choices. Treatment depends on the size and type of stone. Smaller stones may pass on their own, and we usually recommend drinking plenty of water. There's that water again, and managing the pain. For larger stones, we may need to intervene with medications. Lithotripsy, which uses shock waves to break up stones, or even surgery if the stone is too large to pass or cause complications. One of the things we can tell you when we see your x-ray is, depending on where your stone is located and how big it is, what your percentage chance of passing it on your own is. So here's a couple pictures here for you to look. The one on the left is what the typical operation involves. It's all done cystoscopically, or ureteroscopically is the term, because we go up the ureter tube with a scope. No cutting. We can go up with that scope and guide ourselves up to the stone. And we have all different ways to get rid of the stone, blast it with laser beams. And sometimes we're able to loop and grab onto it and pull it out. And you can see different looks on the right side of this slide, where we showed what a stone looks like through the ureteroscope. And we could kind of see on that x-ray study how it can block the ureter, and that's why it causes all that pain. We talked a little bit about S-wall, or extracorporeal shockwave lithotripsy. And so, sorry, that glasses are slipping. So what is S-wall? Well, this has been something that was revolutionizing kidney stone treatment, with absolutely no other thing than sound waves being blasted through the body. It can break up the stones. So they're concentrated to land exactly on the stone. And we have these machines that we can put you in, and in about an hour's time, convert your hard stone into powder, which passes easily in the urine. Now let's talk about ureteral stents. So these are small tubes that we place in the ureter to keep the pathway open, allowing urine to flow from the kidney to the bladder. Stents are especially useful after a procedure that removes a stone, or when there's a blockage. as they can help reduce pressure and prevent further complications. Now, we'll show you a little bit what they look like. But the stent is almost essential after you've done any kind of procedure in the ureter trying to work there, because it could swell shut and cause the same kind of pain you had with kidney stones. So how do they work? A stent is typically a flexible tube that's carefully positioned to bypass the blockage. It helps to keep the ureter open so urine flows freely, which is critical in preventing any buildup of pressure in the kidney. Stents come in various materials, often used with designs that allow for both comfort and stability during their use. So here's a couple of pictures to show you basically how what they look like. This is a stent you see on the left-hand side. They've got a curl on the top and the bottom. That's to keep it from what we call migrating or moving up and down or coming out on its own. So once it's placed over a wire that takes that curve out. And then once we get it into the right position, like you see on the right side, where one part of it's curled in the kidney and the other part is curled in the bladder, it'll stay there and bypass any blockage. So a stone that could be in the ureter or the kidney blocking off intermittently, any of those problems. Or as I mentioned earlier, if we do surgery and the ureter were to swell shut, that would also cause pain. So that's what it looks like. We may talk in another episode about ureteral pain and discomfort. I have had several comments about that. And I have some tips and tricks, but we'll do that on a different episode. So while stents are effective, they can sometimes cause side effects like discomfort, frequent urination, or a feeling of pressure. Occasionally, patients experience more serious issues like infections or stent migration, which we talked about how it could come out. It can still sometimes come out, although these are pretty uncommon. It's essential to monitor patients closely and manage any symptoms as they arise. So you're going to be still sticking with us while you have the stent in. Here's a quick tip. If you have a stent, it has to be removed. They're not put in permanently. Like sometimes you think about these stents they talk about in the heart, which are, this stent has to be removed. It will block eventually on its own. So you have to have it taken out. Make sure if you have a stent in that you're following up with your urologist to have it removed. I have seen some bad cases where patients have neglected to have their stents taken out, and you know it's a bad case. Sometimes it's an actual open surgery to remove it. So some stents have what we call a dangler, a portion of the stent that extends outside the body. This may look a bit unusual, and boy, have I heard a lot of comments about that one, but it's very practical. Danglers make it easier to remove the stent without needing additional instruments. They're temporary, and despite their odd appearance, they serve a very useful purpose. So the primary benefit of a dangler is that it allows for the simple stent removal, often without the need for cystoscopy. Now, most of the stents are removed in the office under just a little numbing medication, and we go up with a scope and just grab it and pull it out. Simple for us, but a little more complicated for the patient. So this can reduce the use of a dangler, can reduce the discomfort and also cost, making it a good option for patients who might need a stent only for a short time, such as what we do with surgical procedures where we don't need to keep the stent in except for let the swelling to go down. It's a small convenience that makes a big difference for both patients and providers. And it really does make a big difference. Let's show you what one of those looks like. This is a dangler stent. Remember, you saw that stent before with the curls. It still has the curls, but it has this like fishing string coming off the end. That's the end that's going to be hanging out of your urethra. So if it's you're a male patient, it's going to be coming off the tip of your penis, and typically we'll tape it down so it doesn't get accidentally pulled. And if you're a female patient, you will often tape it to the inside of the leg. But that's what it looks like. The nice thing about it is that removal is very simple. All you have to do is grab that string and pull it out. Now, most of the time, patients don't take these out themselves. Sometimes accidentally they do, but oftentimes, they'll come in and actually, most of us, the nurses, can remove stents with a dangler. So once you've been trained how to do it, it's very simple to do. And again, very little discomfort. It does sometimes bother patients seeing that string hanging out, maybe a little discomfort from the string. And I'm saying maybe because I've never had one. I have heard patients complain more about them. Some don't even know they seem to have it. So proper patient education, though, is what's critical. We have to let you know what's there, what to expect. We also want you to stay hydrated and keep the area clean. Should also seek medical attention if you have any problems like severe pain, fever, blood in the urine, which could indicate a complication. Now, a little bit of blood is normal, but a heavy bleeding would be something we'd want to know about. So when it comes time to remove the stent, the process varies depending on whether it's a dangler or not. Stents with danglers can often be removed quickly and painlessly, while those without may require cystoscopy. Always require cystoscopy. After removal, patients are typically advised to keep hydrated and avoid heavy activities for a day or two. Really a simple procedure, fast. Should be something can be done even with cystoscopy in a matter of a couple of minutes. With a dangler, less than a minute. Now, here's some advances that I've kind of thought I'd mention that's coming, looking into the future. There are some exciting developments on the horizon. Advances include antimicrobial stents designed to reduce infection. Some people have stents put in for long periods of time, and that's the ones that you would serve with something like that. Short-term stents really don't matter. And biodegradable stents, which don't need to be removed. They just kind of melt away on their own in the right amount of time, and you're done. You just urinate the stuff out. There are also improvements in minimally invasive procedures, which continue to make stone removal safer and more effective. So to summarize, we covered the basics of kidney stone, including their symptoms, diagnosis, and treatment. We discussed ureteral stents, why we use them, and how they work, as well as the role of danglers in simplifying stent removal. Hope this has given you a clear understanding of these essential tools in the kidney stone management. So I hope that was interesting. I hope you learned a little bit about kidney stones. And I think I will do something about the danglers in particular, because I think that would be a good episode to kind of highlight. Especially seeing that I've had some comments. If you've had a kidney stone and had a stent placed, send me a comment. Let me know how it was, what your thoughts were on it. I'll kind of include that in the episode coming up. So I'd be always interested to see how people that have had these things feel about them. Now, of course, after 40 years of being in urology, I've seen a whole lot of patients with kidney stones and stents, and I can tell you that I've got a lot of experience of what it's like to have it vicariously, but I never had a stone, and I hope to never have one because it is not fun. But don't worry, if you have one, we'll be there to take care of you. So with that, I hope you enjoy the UroPatient podcast. Be sure to like and subscribe to our channel, and we'll see you again next week.
Bye.